out of the screen share. Bear with me. Is it F5 or F7 to start the show?
I can hear you.
Right. Welcome, everybody. Welcome, everybody. I am very excited to talk to you about long COVID. We'll just dive right in. A little bit of an outline today. I won't read that. As Allison said, I'm a licensed naturopathic doctor in California and went to school in Oregon, where we were trained as primary care physicians with an emphasis on natural and whole person healthcare approaches. And so I will use everything from conventional medical testing and pharmaceutical medications all the way to the other end of the spectrum with things like diet and lifestyle, as well as IV nutritional therapy. My current practice at Amen Clinics, we specialize in brain health. And so we treat everything from neurodevelopmental conditions to complex psychiatric illness to traumatic brain injuries and neurodegenerative disease. So there's a lot of overlap between what we do and what Cognitive Care Solutions is doing. When I was in medical residency, I was very fortunate to be exposed to Lyme disease and mold toxicity cases quite often. And this was right in the middle of the pandemic. And so we started seeing some of the first, not only acute cases of COVID-19, but the first cases of long haul COVID as well. And we were quite surprised at how similar it presented to Lyme disease and other chronic complex environmental and immune related illnesses. So our treatment approaches are very similar to those conditions, and they seem to be helping. I'm passionate about complex illness because I love thinking about things from multiple perspectives and recognizing complex patterns. And I'd like to just remind everybody that I am a doctor, but I am not your doctor. So anything in this presentation is for educational purposes only and does not replace the advice given by your personal healthcare provider. So what is long haul COVID? It's also referred to as ongoing symptomatic COVID-19, although I don't hear that term very often. More commonly, I hear the term post-acute sequelae or PASC. This could be defined either as symptoms from acute COVID that last 4 to 12 weeks beyond the initial infection, or symptoms that begin that are new greater than 12 weeks outside of the acute illness that can't be attributed to another illness. And this is from a conventional medical perspective, not necessarily saying that we don't have pre-existing illnesses that could be aggravating. And multiple organ systems are affected. Symptom presentation can vary widely and can include a variety of different symptoms affecting each individual. What's very humbling about long haul COVID is it can occur regardless of the severity of the acute infection, meaning somebody might lose taste or smell or have mild fatigue or have no symptoms at all when they are acutely sick with COVID, and then develop long haul or chronic persistent symptoms in the timeline that we mentioned. And then some retrospective research studies looking internationally showed that approximately 65% of patients who had acute COVID did continue to have at least one symptom at 6 months from the initial infection. So this is not an uncommon issue. I mean, there were millions and millions of people globally affected by acute COVID-19. To have, more than half of those individuals continue to have symptoms 6 months post is concerning. We don't have definitive answers on what the exact mechanisms of dysregulation are occurring in post-COVID or long-haul COVID. The medical term for that is pathophysiology, but there are some theories. One of the theories is that it is a persistent chronic viral infection, and there may be little pockets or reservoirs of virus particles that exist in certain tissues in the body. Usually these, are also encased by, a mucus layer called biofilm, which we also see in chronic Lyme and why it can be so hard to treat. Inflammatory dysregulation, this is almost certainly true regardless. There's brand new research that came out a little over a week ago looking at this immune pathway called the complement pathway, and it's part of our innate immune system, meaning it's, even infants who haven't fully developed their immune systems have this kind of immune response. And it showed that there's persistent activation of this pathway in long haul COVID. The authors of this paper proposed some medications that should be researched that we know are complement inhibitors, that they block this pathway, but they haven't been researched in long COVID. There may also be imbalances in the microbiome, particularly in the gut. Autoimmunity, meaning the presence of the virus stimulates an immune response where the immune system gets confused. And instead of attacking the infected cells, it starts to attack other cells in the body as well. Inflammation of the blood vessel lining, as well as abnormalities with clotting. This is why we tend to see a lot of clot events or strokes that have occurred during acute COVID-19. But even chronically, we tend to see more viscous or thicker blood. And there are some things that we can do to help thin the blood, and that often is helpful. And then there's also the impacts of psychological trauma. I'm very disappointed in how Western medicine has communicated this concept. They've often told patients that their illness is in their head, as if it was some kind of made up phenomenon, rather than identifying the fact that the brain and the immune system communicate in some very hardwired physiologic ways that we know exacerbate conditions like chronic fatigue syndrome, fibromyalgia, Lyme disease, mold toxicity, and the like. This is just a diagram that kind of goes over what we were just talking about. There's the acute infection, there can be symptoms that persist, or there could be new symptoms that develop. Many organ systems can be affected, but the ones that are most significantly impacted include the brain. This can show up like fatigue, exercise intolerance, which is where somebody might, do a mild to moderate exercise routine and feel flu-like symptoms, sometimes persisting days after the exercise. This is referred to as post-exertional malaise. Psychiatric symptoms may be new or could develop, could aggravate, sorry. Loss of taste or smell or changes in taste or smell. I've had patients say everything tasted like garbage for months after having COVID. I've also had, we were just talking before this conversation about red wine tasting like vinegar. That's another example. Cognitive dysfunction like brain fog, memory issues, new onset dementia, or acceleration of pre-existing dementia. And the autonomic or automatic nervous system that regulates things like breathing, heart rate, and blood pressure can also be impacted and cause positional changes in heart rate and blood pressure. Chronic pain syndromes are quite commonly aggravated by long COVID or new onset. This could be muscle pain, joint pain, muscle loss. That tends to be worse in patients who have post-exertional malaise because they're not able to exercise, so they're losing muscle. We talked a little bit about the clotting phenomenon. So we tend to see thicker blood, which, because we require blood in every organ in the body in order to get oxygen and nutrients, as well as get out waste material, this can result, just having more thick blood can result in consequences for multiple different organs, particularly brain fog. I've found that if we're doing everything we can to support the brain, and we're still not seeing improvement, things that help reduce blood viscosity can improve oxygenation and blood flow to the brain. Heart injury, heart failure in extreme cases, arrhythmias or imbalance, in the rhythm of the heartbeat, and then blood vessel wall damage, which I mentioned before. I see a lot of menstrual dysregulation. So this could be irregular cycles like missed, like not having menstrual periods or having them be much more irregular. Instead of every 28 days, some of them are 40 days, some of them are 15 days. Polycystic ovarian syndrome often gets worse with long COVID. And then premenstrual dysphoric disorder, which is a severe form of PMS with severe mood symptoms. Impacts on libido and erectile and ejaculatory function are also observed. Respiratory, I don't see this with everybody, but the ones I do, it tends to be more severe. This could be cough, shortness of breath, sore throat, swollen lymph nodes in the neck, chronic sinus infections, and also this very common bacterial infection called mycoplasma, which acutely is diagnosed as walking pneumonia or a milder form of pneumonia. I often will see it become reactivated in a patient who has a more chronic immune issue. Digestively, we may see gas bloating, diarrhea, constipation, overgrowth of bacteria or yeast in the small intestine where they're not supposed to be. They're supposed to be predominantly in the large intestine. And then what we call post-infectious IBS, which we often see with food poisoning. Somebody gets food poisoning, they get over the food poisoning, but their GI symptoms don't get better. These symptoms, not just the digestive, but all the other ones I listed, are not an exhaustive list. There are many, many more. One of the first articles I read talking about long COVID way back in, this would have been probably early 2022, was saying a patient reported, it's like reaching my hand into a grab bag and pulling, out a piece of paper among, a big collection of papers of what my symptoms are going to be today. It's just a beautiful graphical depiction of what we just covered. Medical research has not found an effective conventional approach to treating long COVID, only the management of symptoms. There are not any available drugs currently that have resulted in the complete resolution of symptoms. In other words, there's no black and white, one size fits all, diagnosis A equals treatment B, medication intervention. And some of you who have had experience with integrative medicine will know this, but the Western medical paradigm, which is focused on diagnosis A equals treatment B, is not well equipped to support complex multi-system illness. There are both logistical as well as philosophical limitations to this. One is having short visit times. When you have 15 minutes to spend with a patient and you're seeing 15 to 20 patients a day, it's really, really hard to actually be present with somebody, and that's not always the doctor's fault. But conventional medical training with an overemphasis on only one target for treatment leads to a sort of medical tunnel vision. Complex problems require complex solutions. We have to think about how all of these potential interactive disease pathways are happening and co-occurring. We also have to think about how human beings are biological, psychological, social, spiritual, and interconnected with our environment. And treatment should account for this. Our assessment should be comprehensive, not just conventional medical blood testing and imaging, but also specialty functional med testing like gut or stool testing, looking at hormones, looking for the presence of insect or animal transmitted infections, and thinking about the role that chronic low-grade sinus infections, especially if someone was exposed to mold, can have as well. We also have to be flexible as providers and be able to individualize our treatment. Enter the naturopathic or integrative approach. I use these terms interchangeably, but they are a little bit different. When we think about integrative, we think about how we think about treating the whole person. We think about using whatever tool in medicine that's available to us, natural or pharmaceutical. How we can put all that together. But naturopathic goes just one step deeper with regard to thinking about how if we're not living the way that humans are meant to live as beings connected to nature, we're going to be sick. And this is, of course, a huge problem in our modern life because many of the ways we live are not the way that our ancestors lived. And we've made a lot of scientific and technological advancements, but we often live unsustainable lifestyles that lead to burnout and disconnection. The early naturopaths in the beginning of the 20th century would say we were sick because we violated nature's laws. And they took they had a little bit more of a antiquated for us language around that, but that's the basic idea is we're not living in alignment with the natural world, so we're going to see problems. This approach clinically is highly individualized. We identify unique risk factors as well as what pre-existing medical conditions are present, and we try to detective together with the patient what our ongoing obstacles to recovery are. And then we can adjust and create a treatment plan that accounts for the individual patient's needs, goals, values, preferences, as well as logistics and budget. The only downsides that I can think of with this approach include the time, both on the provider part as well as the patient. There's a lot more involved in carrying out a treatment plan like this. It's also, cost prohibitive for many because we don't fit inside an insurance-based model. There are naturopaths that take insurance, but the more I hear about how they practice, they are very limited in the time that they have for patients and often can't go as comprehensively. There's complexity to treatment, and there are fewer knowledgeable clinicians. What are some of these obstacles to recovery that I mentioned? Frank disease or more obvious disease would include things like diabetes, heart disease, pre-existing respiratory diseases, a more overt immune compromised condition like being on immune suppressive meds for autoimmune disease or organ transplant rejection therapy, or if they have HIV, cancer, and chemotherapeutic history of chemotherapy treatment, nukes the immune system and can also make the brain more susceptible, underlying autoimmunity or dementia. Functionally speaking, there's two things that predominantly cause most chronic illnesses, and that's stress and inflammation. Now, there's a lot of different kinds of stress, psychosocial stress, cellular stress, and a lot of different kinds of inflammation, but it can pretty much be boiled down to those two things. So we think for each individual, how much stress, what's inflammatory in this person, and how do we drain our proverbial overflowing bucket to reduce somebody's severity. A lot of the people that I saw in 2022 and early 2023 were very exasperated by the fact that they developed long COVID. They said, I was perfectly healthy before this. There was nothing else going on. But what we often find when we take a deeper look is their bucket was close to overflowing. They just didn't know it. They weren't having symptoms yet. And this is, of course, not to point blame or say that it's any individual's fault, but to recognize that this wasn't just a brand new problem. And if we figure out what else is in your bucket, we can create a more effective solution. Environmental toxins like mold, heavy metals from things like mercury dental fillings, high tuna intake, working with cars, machinery, welding, chemical toxins like farming or industrial chemicals, as well as animal and insect transmitted infections like Lyme disease and others. Also, chronic viral infections like herpes viruses and Epstein-Barr virus, which technically is a herpes virus. This is the virus that causes mono and can become reactivated following COVID-19. We talked before about chronic sinus infections and the gut microbiome. Any musculoskeletal injuries or surgeries can also contribute to chronic inflammation. And of course, head injuries. There's an amazing book that came out about a year ago called The Myth of Normal by Dr. Gabor Mate. He is a medical doctor in Canada who has written and spoken extensively over the years on the relationship between trauma and addiction to chronic immune and other biomedical issues. This is not saying that these illnesses are psychological in origin, but we do know that the rewiring of the brain that happens in complex trauma does affect our immune system. We see much higher prevalence of autoimmune disease in people with a trauma history, and it tends to be a lot harder to treat autoimmune disease until we start to address the underlying trauma. Severe stress that is ongoing can also be a factor, as well as our capacity to regulate our nervous system state, which means to be able to gracefully transition out of fight or flight and into rest and digest. I'm gonna pause real quick just to check in on time. I forgot to grab my watch to keep an eye, so I don't want to exit the presentation. But how are we doing on time, Allison? You're muted.
It's 12:25.
Okay, perfect. Thank you. Other ongoing obstacles. So this goes back to what I was saying about a more traditional foundational naturopathic view, which is not anti-pharmaceutical, by the way. It's just anti-using pharmaceuticals to mask symptoms in place of identifying and treating underlying issues. But I do use them frequently to support people. But living an unnatural lifestyle can make it a lot harder to get better. So if we're eating foods that are very inflammatory and processed, as well as low in nutrition, or foods that would generally be considered to be healthy, but for us, we're sensitive to them. For example, I'm sensitive to gluten and dairy, and I found that out later in life, then that will contribute to inflammation as well. A sedentary lifestyle, we know, can cause problems. The challenge here is if a patient with post-exertional malaise is unable to exercise to, to any moderate or high intensity degree, forcing somebody to push through that is not an effective strategy and can actually delay recovery. So I always advocate for low intensity movement because we know that some movement is going to be good, but we may have to fine tune how we do that for each individual. So I'm a big fan of things like Qigong and Tai Chi. I had a patient who yoga still flared her PEM, but she could do walking. So I said, okay, let's do walking and let's experiment with maybe 5 minutes of a Qigong video on YouTube and see if we can tolerate that. Many of us are dehydrated, so that's a factor as well. Loneliness and social isolation. This one does not get talked about enough in the medical space. It's often talked about in psychotherapy, but not in medicine. And there are biomedical consequences of not feeling connected to other people and not feeling connected to ourselves. We know that oxytocin has pain and inflammation modulating effects. If a patient doesn't have access to social relationships, sometimes we may even consider intranasal oxytocin. But whenever possible, I encourage people to foster connections with people they feel that they can be themselves with. Unnatural breathing patterns, I'm catching myself doing it right now, but not taking full deep breaths. Sleep disturbances, such as insomnia or obstructive sleep apnea when you stop breathing, and specific nutrient deficiencies like vitamin D and iron. So now getting into some of the more nuances of treatments by organ system. Immune modulators are things that balance the immune system. What this means is we don't want to globally suppress the immune system unless we absolutely have to. With things like steroids, immune suppressive drugs, this is to prevent, organ transplant rejection or to manage severe autoimmune disease. But it's not a good strategy for people who have an imbalance in the immune system where the body's ability to fight infections is weakened, but this kind of unproductive spinning your wheels type inflammation becomes overactive. So we think about it like this. We want this strong ability to fight infections and a controlled inflammatory response that is appropriate to the issue at hand and doesn't keep the fire burning. So we use a variety of tools to do that. Low dose naltrexone is one medication. I provided this resource because we could do a whole talk just on LDN, but it's an anti-inflammatory medication that promotes regulatory T cells or anti-inflammatory activity without suppressing the immune system compared to a steroid. Functional mushrooms like reishi, turkey tail, lion's mane are not only good for the brain, which they are, but they are also really good at promoting that balanced immune response that I just mentioned. High potency curcumin, which comes from turmeric. Liposomal just means it absorbs better, can be really helpful. I see a lot of vitamin D deficiency, so we can raise that to the target range of 60 to 80. Not just what conventional medicine considers normal, which is greater than 30. Thymus gland exists in our neck, but atrophies as we age, and it creates immune signaling molecules. And so we can actually supplement with those, and those can make a big difference. Melatonin has anti-inflammatory and antioxidant effects. And even medications like ivermectin, hydroxychloroquine, Maraviroc, and a few others can have their place. I've seen patients do well with some of these. It is highly individualized, and I strongly discourage folks from ordering them from online sources, usually internationally, because we don't know if there might be contaminants. So I recommend talking to a doctor about these. Antimicrobials are anything that have antiviral, antibacterial, antifungal effects. I use a lot of herbs that have a broad spectrum of action, meaning they kill a variety of different organisms. Things like Japanese knotweed, which we use a lot for Lyme disease, and artemisinin. Methylene blue is a medication that I've seen helpful in a number of cases, but it can interact with serotonin medications. So that's another one that I don't recommend people take unless they, are being supervised by a doctor. You can buy it on Amazon as a chemical, because it's been used as a chemical dye for over 100 years, but it is often filled with heavy metal and other impurities. So I do not recommend doing that. Ivermectin also has some not just antiparasitic activity, but some other antimicrobial activity as well, and may be exerting some antiviral effects. Antifungal herbs, this would be if we have a yeast overgrowth in our gut or there's been a history of mold exposure. Antiviral herbs, not only herbs that may have activity against SARS-CoV-2, but also against other herpes viruses. And if we find that any of our patients have reactivated mycoplasma or another respiratory infection, not the same as the sexually transmitted chlamydia, but respiratory chlamydia, or tick-borne infections, we may use prescription antibiotics or herbs. If there was only one tool I could use to deal with long haul COVID, especially with a lot of brain involvement, it would be hyperbaric oxygen therapy. There were a few research studies done that showed that 40 daily 1-hour sessions led to not only significant improvements short after the end of the series in neurocognitive function and fatigue, but that many of these results persisted at a 1-year follow-up. Photobiomodulation is using light, particularly red light therapy, to stimulate the mitochondria in the brain, which increase energy production and have an anti-inflammatory effect. We also use a lot of herbs and nutrients, including things like as simple as B vitamins and omega-3 fatty acids from fish oil. These can have beneficial effects on the brain as well. Smell retraining and vagus nerve stimulation. These are just some of the sample research papers on hyperbaric oxygen therapy and photobiomodulation. Gastrointestinally, we could do a whole talk just on this, but if someone has a lot of gas, bloating, inability to digest their food, I really love bitter herbs. If we've heard of Angostura bitters or like cocktail bitters, the reason, people have been taking bitters for so long because we don't just have bitter taste receptors in our mouth, but all the way throughout our GI tract. So bitter tasting molecules from those types of herbs have an effect on our ability to digest food and move everything through the GI tract so we don't get constipated. Also, anti-inflammatory support for the lining of the intestinal tract, probiotics, prebiotics, and postbiotics are things that healthy bacteria make that have very anti-inflammatory effects. How are we doing on time?
12:35.
Thank you. Okay, so hormonally, our adrenal glands are, I'm going to speed up just a little bit, but our ability to have resilience to stress depends on our adrenal glands working optimally. The thyroid gland is often very, very commonly affected in long haul COVID, and there are certain minerals like iodine and selenium that can be helpful. And then sometimes I will prescribe thyroid medication. And then reproductive hormones, particularly for women, but for men as well. I see a lot of low testosterone in men, and that is going to affect your brain. Vascular anti-inflammatories, these are going to be things like antioxidants, really brightly colored fruits and vegetables, blueberries, hawthorn berries, although people don't usually eat those. It's more of a supplement. But blueberries, raspberries, bell peppers are all going to be high in a lot of these micronutrients. And then naturally, blood, wouldn't call it a blood thinner, but can be supportive of the clotting that we tend to see is something called nattokinase. It's an enzyme that is available as a supplement. And then in severe cases, we may do anticoagulant medications. Detox support, things like activated charcoal, sweating, sometimes even more aggressive heavy metal detox. And then for the lungs or respiratory tract, nebulizing this antioxidant called glutathione. Glutathione is great because it's very anti-inflammatory. And I use this a lot in patients who have post-COVID cough or shortness of breath or chest pain. And nebulizing just means that you have this device that you pour a liquid in the chamber, and then it creates a mist that you breathe in through the nose, and it gets into the lungs as well as the sinuses. Herbal cough syrups, there's a variety of herbs that can help expel mucus from the lungs, and nasal sprays if there's any chronic sinus congestion. I'm a huge fan of this X Clear Rescue because it's like $11 at Target and it works really well. It has xylitol in it as well as things like oregano and eucalyptus. It burns a little bit, but it can really help people breathe better. Got a couple of cases to kind of bring all this together. So this first one was a 25-year-old male who was traveling in China in fall of 2019. And we did not confirm it, but we suspect that he had acute COVID-19 because he had a very severe upper respiratory infection. When I saw him several years later, he had what we call in naturopathic medicine the $1 million workup, which is where you've seen every specialist under the sun and conventional healthcare setting, and they don't know what's going on. And that's essentially what they did. The lung biopsy was inconclusive. The chest x-ray showed nodules. He had chest pain, headaches, brain fog, fatigue, shortness of breath, and post-exertional malaise. He couldn't go to the gym, which was something that was very important to him. And he was having these coughing fits that were triggering vomiting and interfering with the ability to sleep. So Kaiser recommended an antacid to kind of prevent the vomiting, as well as a typical asthma type inhaler, and neither of those were helpful. And then they did give him a cough medication that stops the spasm of the esophagus, which actually did help a little bit. It was helping him to be able to sleep, but it was really symptom management while we did these other things. We did a comprehensive lab panel, and we found that he had a reactivated Epstein-Barr virus. He was borderline hypothyroid, and he had high thyroid antibodies. So kind of a little bit of an autoimmune thyroid picture. Is everyone able to hear me? It's for some reason telling me my connection is unstable.
I can hear you.
Okay, that took about 10 seconds to hear, so there's probably a delay. He had vitamin D deficiency as well as high strep antibodies. So what was our approach? We did nebulized glutathione as well as colloidal silver, not at the same time, but different times a day. We used some herbs to address the cough and any kind of persistent the other lung symptoms. We gave him low dose naltrexone, which is that anti-inflammatory medication I mentioned, and acetylcysteine, which helps break up mucus, immune mushrooms, fish oil, and vitamin D. I put him for a short period of time, like 3 months, a low dose of thyroid medication, as well as this adrenal hormone called DHEA. And we had him avoid sugar and dairy. This was also a fortunate case in that financially, he was able to do IV nutrient therapies, which I am a huge fan of, but they can be cost prohibitive. This includes things like B vitamins, vitamin C, minerals, and he was doing a lot of glutathione. Not just nebulizing, but he was actually able to get it injected as a shot 3 times a week from a local clinic, and that made a huge difference for him. We also had him do vagus nerve stimulation, which calms down fight or flight. And midway through treatment, actually about 6 months into it, we saw a new mycoplasma become reactivated. It was negative before. Well, he had antibodies that suggested he had been exposed, but it wasn't an active infection until we started dealing with the other layers. And so it was interesting because we were doing so well. And then he was like, I don't feel good. And then he was like, my cough's back. I feel short of breath. I'm having chest pain. So we did a chest x-ray and a blood panel. And that's when we found the mycoplasma. We treated him with antibiotics and some, gut protective support, probiotics. And that made a big difference. We also did a little bit of detox. Gradual improvement throughout this period, but particularly when we last spoke in January, he was doing very, very well. No more cough, no more shortness of breath, way higher energy, no post-exertional malaise, and no headaches. So our treatment window was, as you can see, several months. This is not a quick fix situation, which is definitely unfortunate. But also, this is somebody who had spent 3 years dancing through the Kaiser system and not getting improvement. And we are continuing with maintenance therapy. Our second case was a little bit earlier. This was a 62-year-old female that I saw at my last clinic. She developed fatigue, brain fog, and joint pain following COVID-19 vaccination, as well as borderline. We thought she might have Sjogren's syndrome, which is an autoimmune condition that causes a dry mouth and dry eyes. We did comprehensive lab testing and found Lyme disease, a Bartonella infection, vitamin D deficiency, and reactivated Epstein-Barr virus, as well as mold at home. So we detoxed her, got her on LDN, got her on some thymus gland peptides. We treated the Lyme and Bartonella with antibiotics as well as herbs. She did do some IV therapy as well, and then not because I told her that she needed to, but she decided to move to a different house, which likely did make a big difference because she felt a lot better after that. If you would like to work with me, there's 3 different ways to do that. You could do the Amen Clinics package where you get the brain scan. You get to talk to one of our psychiatrists to go over that. You do blood work and then see me, and we can fine tune what it is that we're doing. You can also see me alone for integrative medicine, which is kind of everything that we just talked about, and it's just billed for time. You don't have to do the whole package. But I am only licensed in California, so I only offer that to California patients. But I do some health coaching in other states, just not the ones listed for legal reasons. And if you'd like to reach out to our office, my assistant Jake can be reached at docplante, Plante, admin@amenclinic.com. That's clinic singular, not clinics, even though that is our brand name. So just that one letter can throw you off. And then I'd like to open it up for about 5 minutes of questions.
Thank you so much. Wonderful presentation. Okay, who has questions? I think there might be one in the chat.
Let me pull that up. Yes, so phosphatidylserine. So phosphatidylserine is excellent. It is what we call a phospholipid, meaning it is part fat, part water soluble molecule, and it makes up our cell membranes. And so when there's a lot of inflammation, it can cause damage to our cell membranes. And our brain is also about when you take all the water out of it, it's about 60% fat remaining. So phospholipids can be very good from a